Hi, it's Christina with the Sisyphean Journal. I've already covered the 2 death anniversaries we have today, and I'll link to them below. But one of those deaths is that of Debra Gray, who went to Hillview in 1989, and unfortunately Gideon Kioko was overseeing her care. So you can follow the link below to her story. But from a medical board document from 2005, remember Debra died this horrible death in 1989, and a second woman, Susanne Logan, was mortally injured. It just took her many years to die in a nursing home 3,000 miles from her family. I'm going to read about what kind of, Kioko blamed everything that happened to Debra and Susanne on the clinic. They are bad. They did not provide blah, 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 blah. Let's read what his own practice was like, okay? Respondent, Kioko, rents an office in Hyattsville, Maryland on a part-time basis from a dermatologist where respondent performs outpatient abortions, including second trimester abortions, and has an ambulatory GYN practice. According to respondent's office staff, respondent performs 1 to 3 terminations of pregnancy procedures a week and sees ambulatory GYN patients, including older patients for hormone replacement therapy. Respondent's office consists of 2 examination rooms, an office, storage area, closet with dermatological samples, so I guess he's letting his buddy store things there, and a bathroom. 1 examination room is used for termination of pregnancy and GYN examinations. In the room, there was a sonogram machine, aspiration machine, standard GYN examination table, sterile specula, sink, and sharps container. The carpeting was stained and unclean. Why would you have carpeting in a procedure room? There's going to be blood and bodily fluids falling on it. You can't clean carpet. You need to have a tile floor that can be cleaned readily. Probably, preferably a ceramic tile floor because those clean really well. The aspiration machine consists of a section of tubing that goes from the machine into a glass receptacle and another section of tubing that goes from the receptacle and is attached to a cannula that is inserted into the patient. Office staff stated that respondent does not use a new sterile aspiration tube for each patient. The tube is used throughout the day and then washed and reused until it becomes opaque, and then it is discarded. An ultrasound machine in the procedure room. However, the printer has not worked in a while, hence no hard copies are obtained. So he just make anything up he wants. He doesn't have a hard copy. Respondent did not have a crash cart in the office. That's, the emergency cart to deal with when a patient stops breathing or her heart stops. Respondent did not have any laryngoscope and endotracheal tubes. That's to put down the patient's throat and make sure that the air, when you're performing artificial respiration, the air is going into the lungs and not into the stomach. Very important piece of equipment. Oh, hold on, I gotta pause. I had to back up those interruptions. Somebody came to the door and startled my dogs. Okay, oxygen equipment included ambu bag, face mask, nasal tubing, and oxygen cylinders, or red biohazard. Oh, hold it. Respondent did not have the laryngoscope and endotracheal tube, did not have the oxygen equipment, did not have the ambu bag, did not have a face mask, did not have nasal tubing, did not have oxygen cylinders, and did not have red biohazard bags in view, so they weren't handy. On the second site visit, October 13th, 2005, so this is 7 years after Debra Gray's death, office staff informed board that the crash cart consisted of an empty capped syringe and 2 vials of epinephrine. These items were in a rubber examination glove taped to the wall of the procedure room. That's his crash cart. And this is after what happened to Debra and Susanne. He knows how quickly things can go south, and he's totally unprepared for it, even after he knows what happened to them. The office does not have a policy or procedure manual for emergencies such as significant bleeding. Well, he's not equipped to deal with it anyway. The other examination room contained an examination table and cabinets containing IV fluids. The other room is used as a recovery room. The storage area contained an examination table, and an autoclave. There were samples of medications and birth control pills on an open shelf. There is a small laboratory with a HemaQ machine for obtaining hematocrits. Respondent obtains RH typing but does not obtain blood typing, so he is not ready to give vital information if his patient needs a transfusion from hemorrhage, and hemorrhage is a very common abortion complication. Respondent informed board staff that he does not keep appointment logs. Patient sign-in sheets are destroyed the day of the appointment for confidentiality reasons. In other words, he doesn't want the board knowing who came through. That way, something bad happens, he can throw the records away, pretend she was never there. Office personnel. According to office staff, respondent had 3 employees: his wife, his niece, reportedly a nursing student, who occasionally is a receptionist, and a medical assistant / office secretary who works part-time in the morning for 2 or 3 hours. Respondent has employed the medical assistant / office secretary since April 2005. The medical assistant / office secretary was not aware if respondent had hospital privileges. The medical assistant / office secretary obtains vital signs, performs finger sticks for hematocrit, sterilizes equipment, assists in procedures by handing respondent KY jelly and applying betadine, and cleans the office after procedures. Well, she's not doing a very good job, but you don't make it easy for her with carpet on the floor, do you? According to office staff, respondent's wife assists with the procedures when the medical assistant is not working. Okay, so there's no sign that, where are his wife's qualifications? According to respondent's wife, she does not work for respondent. She is employed full-time as an administrator of a home health agency. Respondent's wife reports that she occasionally assists with filing, phone coverage, and office duties in the evening or Saturdays. Respondent's wife reported that on occasion she has assisted with prepping a patient for termination of pregnancy procedures, which she would chart and sign as the assistant, so she's falsifying medical records. Respondent's wife states that she is an RN licensed in Maryland, but was unable to provide the board staff with the number. That's her license number. That's like saying you're licensed to drive, but you have no idea what your driver's license number is. There are at times only 2 people in the office besides the patient, that is, respondent and the medical assistant / receptionist. There are no patients on Monday, 1 or 2 patients for termination of pregnancies on Wednesdays and Thursdays, and GYN patients on Saturday morning. Here we get to the juicy part: termination of pregnancy procedures. And Susanne Logan had died by this time. I don't know if he knew that, because I don't know if he cared enough to know that. He certainly knew he lost the lawsuit. According to office staff, respondent performs ultrasounds on most patients to determine gestational age. As noted above, the printer has not worked for a while. Therefore, no hard copies are obtained. Hold on, let me pause my washing machine a minute so it's not making so much noise. According to office staff, respondent makes a determination of biparietal diameter, that's here, and crown length, that's from the head to the bottom of the little butt, because fetuses kind of curl up, so you measure crown to rump. But respondent does not always document this information. Respondent informed board staff that he obtains a medical history from all patients, but he does not always document the history. Respondent reported to board staff that he does not perform physical examinations except if the patient presents with significant medical history. Doesn't even make sure she's healthy first. Respondent reported that he performs a pelvic examination on all his patients. Well, they're up on the table. According to office staff, respondent does not always complete the history in physical form. According to office staff, when respondent performs a termination of pregnancy procedure, the patient has an initial blood pressure taken, is placed on the table with the drape across her abdomen and legs. Respondent preps the perineum with betadine, inserts a speculum upon which KY jelly from an unsterile tube has been applied, then exposes the cervix. Respondent uses a cotton swab dipped in betadine to clean the cervix. Respondent then performs a paracervical block. According to office staff, patients do not receive any type of sedation, intravenous anesthesia, conscious sedation, or general anesthesia. Well, maybe he learned his lesson from what happened to Debra and Susanne, and that he's not going to knock them out because they're going to stop breathing. And you have to give him credit for that. A lot of these abortion doctors have the receptionist slash medical assistant acting as a anesthetist. If there is increased bleeding, respondent administers Pitocin intramuscularly or Methergin transvaginally into the cervix. That's to make the uterus clamp down so it can stop the breathing. After the termination of pregnancy procedure, the patient is walked to the recovery room and 1 blood pressure is taken. Respondent checks the patient in an hour to be assured that there is adequate hemostasis, that is, the patient has stopped bleeding. An hour. They should be checked every 15 minutes at the minimum. And he should be taking a blood pressure before she gets off the table, because you want to be able to respond if you notice that her vitals are out of whack. Respondent provides the patient with a prescription for an antibiotic, usually doxycycline. The patient is given a printed sheet with instructions and is seen by respondent for follow-up in 2 weeks. Respondent does not send any tissue to a laboratory for pathological examination, so he's not even making sure these abortions are complete. So, there are no CDC guidelines posted in the office. The office carpet was stained and unclean. Tubing on the aspiration machine that is attached to the cannula and inserted through the patient is used throughout the day, where we already covered this. When the suction is broken, contents of the tubing may be reinserted into the patient. Okay, so the problem with opacity is if something goes wrong with the machine, what you just sucked up can go right back in. That doesn't sound good. The sharps container was full and sitting on the floor in the procedure room, not attached and locked to the wall. Respondent does not have a contract for removal of biohazardous material, particularly the aspirated contents of the uterus and bloody sheets. Respondent places material in a red bag and personally disposes of it. Office staff do not know where, so he's too cheap to pay for proper biohazard disposal. He's probably just chucking it in a dumpster. Respondent does not maintain a log for when and how much biohazardous material is picked up. Of course not, because he's just putting it in a red trash bag and chucking it. There were no policy or procedure manual regarding cleaning and or sterilization techniques for instruments and equipment in order to ensure that decontamination procedures are conducted appropriately. So there's no step-by-step guide for what you're supposed to do. In respondent's office, a refrigerator located in the area by the receptionist contained Rogam. That's to administer if the patient needs it for RH incompatibility with the baby. And dermatological medication medicine, along with food, opened soda bottles, and opened condiments. So his medical refrigerator is also the staff snack refrigerator. Emergency backup. Since July 23, 2005, respondent does not have hospital backup for the outpatient abortions that he performs, since he does not hold any hospital privileges. If there is an emergency, respondent calls 911 and the patient is taken to the nearest hospital. So board's preliminary response, a board hand-delivered correspondence, blah, 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 blah. Respondent informed the board in writing that he has purchased an emergency kit. He was in the process of hiring a physician's assistant, and he took a course in CPR to update his certificate. So he wasn't certified in CPR. After what happened to Debra and Susanne, respondent also states that he has terminated his medical assistant because he suspected her of taking office funds. So I don't know who he has helping him. Then we're going to look at the specific problems that sent the inspectors to his office. Actually, I'm going to do that in a separate video because I'm already at 13 minutes. So that's part 1 of Gideon Kioko, the guy who was part of a team that managed to kill Debra Gray and Susanne Logan.